with Rafael Grossmann, MD, FACS. Your card's a surgeon, speaker, healthcare technology innovator with Eastern Maine Medical Center up in Bangor, Maine. The focus of this conversation is going to be on Google Glass. And so just to get us going here, could you kind of tell me how you got involved with Google Glass, how you got started?
Well, Eric, thanks for having me, first of all. I, as you said, I'm a surgeon, first of all, but I've been passionate about innovation in technology to help the way we give healthcare and we do medical education. So I got involved with technology years ago with telemedicine, and in 2011 I was blessed to do a TEDx talk on the use of iPod Touch to do telemedicine for acute care consultations in Maine. And I got a lot of press, and then I started using Twitter and LinkedIn, and started a blog, and then I ended up doing a sort of a course at Singularity University in Silicon Valley actually February 2013, and the formerly called the Future Med program, now called Exponential Medicine. I was there for 7 days with 80 other people. Very few of which were physicians, unfortunately, but a lot of people and healthcare-related people. And we were there for, I said, 7 days, exposed to incredible technology, incredible exponential technology. One of those technology pieces was on Google Glass. We had Babak Parviz, who was the inventor of Google Glass, one of the inventors of Google Glass. He talked to us about that new device, and he had it on, and immediately I had this wow moment where I saw incredible. You know, I've been thinking about bringing telemedicine from the big screens to the mobile devices, and suddenly this guy is telling us, you know, you have this frame that you put on your forehead, and you have a computer in front of your eyes, and you can do anything you can do with a smartphone or a computer with this. And I immediately cornered him, and he told me about the If I Had a Glass, you know, hashtag program. I applied very early. I got my pair of Google Glass with the argument I had about using Google Glass for telemedicine, for teleconsultations, for medical education. And the next day after I went to pick up the glasses, I had a conference lined up at Doctors 2.0 in Paris, conference that I attend every year. And I gave the first probably medical conference on Google Glass. I didn't even know how to use them yet. It was next day, and I couldn't put them on the internet in Paris. But anyways, people got really excited about it. And when I came back to the States, I thought of really putting them to use, and so I selected a case, and I got permission from the patient and the family for a simple case, and I ended up streaming an operation to an iPad nearby with a couple of students watching and connected with me virtually through the Google Glass, seeing my point of view of the operation, asking questions, answering my questions, so virtually in front of the patient doing the procedure with me. And I blogged about that I posted about that in my blog, and that got a lot of attention. And the video sort of went virally, or the video, or not so the video, but the story went virally through Forbes. And that was the first time Google Glass ever was used to do an operation inside the operating room. So that was sort of the beginning. And after that, I started sort of building on this passion for technology innovation with wearable devices, and specifically with Google Glass. And I've been lucky to go around the world as a speaker and sort of a consultant, advisor for startup companies and big conferences like EMMC, Asia Pacific, for example, recently, and a disruptive technology innovation in Berlin, and a number of other conferences. I've been lucky to really travel to almost every continent out there in the last year, talking about the potential for this incredible device as the first step to help us do better care, to do better medical education.
Let's talk about that potential. Where do you see the best uses of Google Glass in the provider environment?
Well, I always say that Google Glass is really the first step in the natural evolution of the device. It's not the perfect device yet. It's the first step. But it has set I think almost the standard for what a wearable device, a really wearable device, not something that we held or something that is in front of our eyes, that without touch, without having to use our hands, allow us to integrate with a digital realm, with an electronic medical record, which is now the standard in the industry for recording healthcare interactions. So the same way that we use a computer or a laptop or a tablet, you know, Google Glass has a screen in front of our eyes that we can look up like we look at the rear view mirror and access information. Now, that has been done, is being done, integrating Google Glass with the electronic medical record. I think that anything that we can do in an electronic manner in the healthcare realm today, we should be able to do with a wearable device like Google Glass very soon. So there's really no limit to what we can do with something like this, because, you know, I can record an interview, I can record an operation, I can stream an operation, I can ask for a teleconsultation to go through, you know, and stream my view of what I need answered to someone anywhere as long as there is connectivity. I can maybe connect with a patient through Google Glass, or a patient can connect with me streaming a question about a lesion or a body part. So from patient to provider, connecting the two, you know, the settings, or a provider to provider asking for consultation or teaching, or connecting with medical students, or trying to learn from an expert remotely. I think the possibilities for this electronic marvel is really only limited by our creativity, I think.